Hi, this is Dr. Carter with InMotion Chiropractic in Buffalo, Minnesota. Just going to give you some tips today as far as how to resolve acute low back pain if you're at home, like on the weekend or whatnot, if you slip a disc or your back goes out. Just a couple tips to help you get through it so maybe you don't miss a kid event or you're not stuck in the hotel room or whatnot. So we got Jordan Scar in here. She's one of our athletes and she's going to help demonstrate some of the exercises for today. Okay? So the first thing we're going to do, well, basically, a lot of times what happens is that pelvis will get out of alignment and then the back muscles spasm to try and protect it. And so what we're going to try and do is certain techniques to get those muscles to relax to help that pain go. And we'll have Jordan Landers on her back here. And what she's going to do is she'll put the broomstick on one side and then it'll be on the opposite side. Okay? And what she's going to try and do is kind of a contract and relax here. So and the idea will be to keep the broomstick level. So this leg is going to push down while this leg is pushing back. All the while trying to get that pelvis on the inside to start to move. Hopefully maybe hear a little audible clunk or maybe a little bit of a release. So if you need to support the head that way. So what she's going to do is push her leg towards me, drive the other one back, and just try and get that pelvis to move internally through there to try and take some of that pressure off. Okay? So she would contract, hold it, relax, contract again, relax, contract, and relax. Do that 5 to 10 times. Try and get that pelvis to move through there. The other thing that you can do is just in general, a nice comfortable position for the low back is to keep it at this 90-90 position. So she's got her hips at 90 degrees, her knees at 90 degrees. And that takes a lot of pressure off that low back and pelvis. What she can be doing at this time is now just really focus on some deep abdominal breathing. So you're trying to cue into the brain that, hey, it's okay to let those muscles relax. Let's take some of this pain away. So she'll breathe in almost through her diaphragm to let things release that way. Okay? Okay? The other thing that she can do is you can use a lacrosse ball, baseball, or even a softball. And what she's going to do is she's going to put it just on her low back, above her pelvis, and just to the side of her spine. And she's going to lay on it here. And we'll keep you in this position here to take pressure off that low back. And there you go. You can put that underneath your head again. So everything in the spine right now, we're just trying to get it to relax, to get those muscles to stop guarding. So again, she'll take a breath in. As she exhales, just think about letting the pelvis sink into it. Let those muscles sink into that ball and just kind of tent over it so we get it to relax. As she starts feeling better, to help it again, what she can do now is take her knee and bring it up to her chest. Depending on how severe her symptoms are, she may only be able to get it to go this far or even half that, but just work within your pain range to get that to relax. Working on the glutes and trying to get that glute muscle to relax a little bit more. So all Jordan's done is she's focused on one glute. She's on half of that foam roller. The leg we're working on, she crosses it over onto that side. Okay? Again, work within your pain tolerance through this. But what she's basically doing is focusing on the back pocket of her jeans right now, trying to get that glute to relax. And so she may twist her pelvis in, twist it out, just getting the glute to relax. If she finds a pretty knotty spot or an adhesion through there, she can focus just a little bit more on there, rock back and forth, forward and back, and just really focus on it, trying to get that to release. Good? And then this is just a good glute stretch. So again, same thing, whatever leg you're working on here, cross that leg over, and then she can focus on bringing the chest over the knee. Obviously, you may not go this far if you're pretty acute, but if she's in that position, hold it for 5 or 6 breaths. Every time you exhale, try and go just a little bit further forward. Now go over the shin, same thing, 5 or 6 breaths. Every time you exhale, try and sink a little bit, and then come over here. Good. None of this is necessarily going to cure or get rid of the issue, but it may help allow you to be a little more active that day, or at least like we talked about, not be stuck on the couch or in bed before you can get in to see your local chiropractor or physical therapist before they can work on that for you.